Cloves are a popular spice known for their aromatic flavor and numerous health benefits. They have been used in traditional medicine for centuries, particularly in Ayurvedic and Chinese practices, to treat various ailments and promote overall well-being. Chewing cloves is a common habit that many people adopt to freshen breath, improve digestion, and harness their medicinal properties. However, like many natural remedies, there are right and wrong ways to use them. Misusing cloves or chewing them incorrectly can lead to adverse effects, reducing their benefits, or even causing harm. In today's, we will explore the 15 fatal mistakes you need to avoid when chewing cloves to ensure you reap their full benefits safely. 1. Overconsumption of cloves. One of the most common mistakes people make when chewing cloves is overconsumption. While cloves are packed with beneficial compounds, consuming too many can lead to adverse effects. Cloves contain eugenol, a potent compound with both benefits and risks. In small amounts, eugenol can help reduce inflammation and act as an antioxidant. However, excessive consumption can cause toxicity, leading to symptoms like nausea, dizziness, and even liver damage. It's important to limit your intake to no more than 2 to 3 cloves a day to avoid these negative effects. 2. Chewing cloves on an empty stomach. Chewing cloves on an empty stomach might seem like a good idea to start your day with a fresh mouth and a boost of energy. However, this can actually irritate the stomach lining, especially in individuals with sensitive stomachs or pre-existing conditions like gastritis or ulcers. The active compounds in cloves can stimulate the production of gastric juices, which can exacerbate stomach discomfort. To avoid this, always chew cloves after meals, or at least with some food in your stomach to mitigate potential irritation. 3. Ignoring allergic reactions. Another mistake that can have serious consequences is ignoring allergic reactions. Although rare, some individuals can be allergic to cloves or their components. Symptoms of an allergic reaction can include itching, swelling, rashes, and even difficulty breathing in severe cases. If you notice any unusual symptoms after chewing cloves, stop immediately and consult with a healthcare professional. Always be aware of your body's reactions to new substances, even if they are natural and commonly used. 4. Chewing cloves during pregnancy. Pregnant women need to be cautious about what they consume, and cloves are no exception. While small amounts used in cooking are generally considered safe, chewing cloves in medicinal quantities can pose risks. The eugenol in cloves has been known to affect uterine muscles, potentially leading to contractions and increasing the risk of preterm labor or miscarriage. It's crucial for pregnant women to consult their doctors before adding cloves or any other herbal remedies to their diet. 5. Using cloves to replace professional dental care. Cloves are often touted for their oral health benefits, particularly for their ability to relieve toothache pain and freshen breath. However, one fatal mistake is using cloves as a replacement for professional dental care. While cloves can provide temporary relief, they do not address the root causes of dental problems like cavities or gum disease. Regular dental checkups, proper brushing, and flossing are essential for maintaining oral health. Cloves can be a supplementary remedy, but should never replace professional dental treatment. 6. Not moderating clove consumption with other spices. Cloves are just one of many spices that can provide health benefits, and they are most effective when consumed in moderation and balance with other spices. Focusing solely on cloves and neglecting other beneficial spices like turmeric, ginger, or cinnamon can limit the variety of nutrients and health benefits you receive. Additionally, overuse of cloves can lead to a buildup of eugenol, increasing the risk of toxicity. A balanced diet with a variety of spices ensures you get a wide range of health benefits without overexposure to any single compound. 7. Ignoring underlying health conditions. Chewing cloves can interact with certain health conditions, making them unsuitable for everyone. For instance, people with bleeding disorders should avoid cloves because eugenol can slow down blood clotting. Similarly, individuals with liver disorders might need to avoid cloves due to the potential for eugenol toxicity, which can exacerbate liver problems. It's crucial to consult with a healthcare provider if you have any underlying health conditions before incorporating cloves into your daily routine. 8. Using cloves as a sole treatment for health issues. Another common mistake is relying on cloves as the sole treatment for various health issues. While cloves have medicinal properties, they are not a cure-all. For example, while they can help alleviate toothache pain, they do not treat cavities or infections. Similarly, while they can aid digestion, they are not a replacement for a balanced diet and proper medical treatment if you have gastrointestinal disorders. It's important to view cloves as a complementary remedy that should be used alongside, not in place of, professional medical advice and treatment. 9. Improper storage of cloves. The effectiveness of cloves is highly dependent on their quality, which can be compromised by improper storage. Cloves should be stored in an airtight container, away from direct sunlight and moisture. Exposure to air, light, or humidity can cause cloves to lose their potency and effectiveness. Additionally, improperly stored cloves can become contaminated with mold or bacteria, posing a health risk when consumed. To ensure you are getting the most benefit from your cloves, store them properly and check for signs of spoilage before use. 10. Using low-quality cloves. Not all cloves are created equal, and using low-quality or adulterated cloves can negate their health benefits and potentially cause harm. Low-quality cloves might contain fewer active compounds or be contaminated with pesticides or other harmful substances. When purchasing cloves, look for organic, high-quality sources that ensure the cloves are pure and free from contaminants. Using reputable sources and checking for certifications can help you avoid the risks associated with low-quality cloves. 11. Chewing cloves too frequently. Frequency is another critical factor in the safe consumption of cloves. Chewing cloves too frequently, even in small amounts, can lead to a buildup of compounds like eugenol in the body, potentially causing toxicity over time. This can lead to symptoms such as nausea, dizziness, and in extreme cases, liver damage. It's important to use cloves in moderation, perhaps a few times a week, rather than daily, to avoid overexposure to their potent compounds. 12. Chewing cloves for breath freshening, without considering oral health. Chewing cloves for fresh breath is a common practice, but doing so without considering overall oral health is a mistake. While cloves can mask bad breath temporarily, they do not address the underlying causes, such as poor oral hygiene, dental decay, or gum disease. Relying on cloves without maintaining proper oral hygiene can lead to a false sense of security and worsen oral health over time. Always use cloves as a supplement to, not a substitute for, good dental hygiene practices like brushing, flossing, and regular dental checkups. 13. Ignoring potential drug interactions. Cloves can interact with certain medications, which can be a serious mistake if not taken into consideration. For example, cloves have blood-thinning properties and can enhance the effects of anticoagulant medications, increasing the risk of bleeding. They may also interact with medications metabolized by the liver, affecting how these drugs are processed and potentially leading to adverse effects. It's crucial to consult with a healthcare professional if you are taking any medications before adding cloves to your routine to avoid harmful interactions. 14. Not considering age and health status. The effects of chewing cloves can vary significantly based on age and overall health. Children, older adults, and individuals with compromised health might be more sensitive to the compounds in cloves. For example, young children have more delicate digestive systems and might experience irritation or discomfort from cloves. Similarly, older adults or those with chronic health conditions may have different metabolic rates or sensitivities, affecting how they react to cloves. It's important to consider these factors and possibly consult with a healthcare professional to determine the appropriate use of cloves based on individual circumstances. 15. Using cloves without proper guidance. Lastly, one of the biggest mistakes is using cloves without proper guidance or knowledge. While cloves are a natural remedy, they are still potent and can have strong effects on the body. Misusing them, whether by consuming too much, using them inappropriately, or not considering potential interactions and contraindications, can lead to serious health issues. It's important to educate yourself about the proper use of cloves, seek professional advice when needed, and approach their use with caution and respect for their potency.